Restraints and restraint alternatives. This information can be found in Chapter 15 of your textbook. In the medical setting, restraints are devices that limit a patient's movement. There are 3 types of restraints. Physical restraints limit a patient's movement. Chemical restraints are any form of medication that is not being used to treat an illness, but is being used to inhibit a behavior or movement. Environmental restraints control a patient's mobility. For instance, placing all 4 bed rails up on the patient's bed is an example of an environmental restraint. Freedom of movement refers to any change in place or position of the body or any part of the body that a person can control. Convenience is any action taken to control or manage a person's behavior that requires less effort by the staff. The action is not in the patient's best interest. And discipline is any action taken by the agency to punish or penalize a patient or resident. CMS, or the Centers for Medicare and Medicaid Services, has rules for restraint use. CMS rules protect the person's right to be free from restraint. Restraints may be used for a brief time to treat a medical symptom that would require restraint use or for the immediate physical safety of the person or others. Restraints may be used when less restrictive measures fail to protect the person or others. They must be discontinued as soon as possible. Often there are causes or reasons for harmful behaviors. Knowing and treating the cause can prevent restraint use. So you want to ask yourself, is the person in pain? Is the person short of breath? Is the person afraid in a new setting? Does the person need to use a bathroom? Is their clothing or wound dressing tight or uncomfortable? Are body fluids or secretions causing skin irritation? Is the person too hot or too cold, hungry or thirsty? Is the person seeing, hearing, or feeling things that are not real? An enabler is a device that limits freedom of movement, but is used to promote independence, comfort, or safety. When the person can easily remove the device and it helps the person function, it is an enabler. For instance, a chair or wheelchair with a laptop tray for meals and writing is an enabler. However, if it is used to limit freedom of movement, it becomes a restraint. When the person wants the bed rails raised to assist with movement, the bed rails are enablers. However, if they are used to keep the person in bed, they are restraints. There are multiple complications from restraint use: bruising, decreased mobility, social isolation, stress and anxiety, increased agitation, loss of independence, loss of dignity and self-esteem, and the risk of suffocation. Decreased mobility from restraint use can lead to pressure injuries, pneumonia, incontinence, and constipation. Here are some CMS requirements. The Safe Medical Devices Act applies if a restraint causes illness, injury, or death. Facilities need to report any death that occurs while a person is in a restraint. They also need to report any death that occurs within 24 hours of a restraint being removed. They also need to report any death that occurs within 1 week of a restraint being moved. Number 4 applies if the restraint contributed directly or indirectly to the person's death. Here are some laws, rules, and guidelines for restraint use. First, a doctor's order is required. The least restrictive method is used. Restraints are only used after other measures fail to protect the person. Restraints do not replace properly supervising and observing the person. When used, the restraint must be the best safety measure for the person. Restraints are not used to punish or penalize uncooperative persons. Unnecessary restraint use is false imprisonment. Informed consent is required. This means the person must understand the reasons for the restraint and the possible risks. The person is told how the restraint will help medical treatment. If the person cannot give consent, his or her legal representative is given the information. Consent is needed before a restraint can be used. The doctor is the person who obtains consent. It's important to observe the person every 15 minutes while they are in restraints. Restraints can be dangerous. Injuries and death can result from improper restraint use. Breathing and circulation problems are examples. Remove or release the restraint, reposition the person, and meet basic care needs at least every 2 hours. This is a picture of a vest restraint. This is a picture of a belt restraint. It's at a 45-degree angle over the thighs. This is another picture of a belt restraint. The bed rails are only raised after the restraint is applied. And this is a picture of a jacket restraint that has positioning slots in the back. And again, the bed rails are raised after the restraint is applied.